had such a fantastic experience in the hospital. The nurses were friendly. They were asking every time they contact, is your date of birth, send your name and stuff, and be sure that they have the right patient. Not once did they not ask that question over there. Always with a smile and always friendly, always on time, caring for me like I never had it before.
And this is probably the most important thing that I would share with anyone. Sitting in my office, no shoulder pain, no neck pain, no shortness of breath, no nothing. I had heartburn. Been diagnosed with acid reflux 5 years prior with a thorough exam, stress echocardiogram, the scope, the whole thing, acid reflux. And that's exactly what it felt like.
And I had Tom on my list as a contact because I knew Tom from many, many years as a Shriner and Mason. I said, Tom, I got one more thing to talk to you about the Buffalo Hospital and doing the fundraising for me. He said, I don't want anything to do with the Buffalo Hospital. My doctor's in Minneapolis.
Peggy didn't let it linger that long. You know, I had just mentioned to her, I said, I have heartburn. I said, and I asked, I said, did I take my Prevacid this morning? Could you grab me another one? And brought it in, and that again is a timed release drug, and so no immediate relief. Chewed up some Tums, didn't do anything. Pepto-Bismol, nothing. Peggy had noticed that I had started profusely sweating, and she said, you don't sweat from heartburn. She says, I'm calling an ambulance. And I said, oh, no. I said, I'm not, no ambulance. There's where we deviate from our training and our common sense is, I said, you can drive me in. My family physician is in Edina. That probably wasn't in the cards.
4 days later, on Sunday, I get a phone call. I just come home, and Tom calls me and says, Ryan, I want to thank you for saving my life. I said, what do you mean, saving your life? He says, well, because you talked to me about the hospital and the experience that you had in the hospital. I told Peggy to take me to the Buffalo Hospital rather than to the doctor in Minneapolis.
He came in, we activated our stat team, and we started, we noticed off of the 12-lead EKG immediately that he was having an acute MI.
Dr. Starr immediately got me in here, and I think that's when my level of concern began to peak. He immediately said, I'm calling this one. That, you know, brought back memories that, oh man, this is maybe a little more serious than what I had been convinced myself of.
We have a set protocol, medical protocol here that our emergency room physician and team follows. When a patient actually arrives into the emergency department, we actually call what we call a stat team overhead for AMI patients. That gives us extra resources to be able to get these patients packaged and all of their labs and all of their interventions needed here at Buffalo within 30 minutes, and they're back out the door by using either a Lina ambulance service or a flight service if needed. From the time that Tom arrived into our door, 11 minutes later, he was actually being transported out by a Lina EMS.
11 minutes amazes me. And I got to be very honest, more concerning to me to look out and have Peggy there with me. I mean, you know, a lot of hospitals would give her the boot. She was able to stay, and there were people within the team that knew us that said, gosh, Peggy, can I call somebody for you? It wasn't necessarily just me. That was probably my biggest concern. Who's taking care of her while I'm laying here? I would say they accommodated that.
The sooner we do interventions to open the artery, unclog the blockage, the less heart damage there is. And the mortality goes up with every minute you wait. Every 10 minutes, your mortality goes up even up to 1%.
And right away you get out on the road and it's lights and siren.
So we've developed a rapid transport system to take people from Buffalo and from Unity. If they're having a heart attack, they get treated with the right medications quickly. The ambulance is called, or the helicopter, whatever we need. We get them in the ambulance quickly, get them to Mercy. While they're driving, the team is setting up. So it's really an extremely coordinated system. Everybody's involved. It starts with the person at the triage desk, the EKG tech, the physicians at Buffalo. They have a special kit there with all the right medication. The HUC calls the ambulance. They notify. We have a special pager system and how to notify the cath lab call team, and everybody's mobilized. It's really an impressive effort to see.
When they start, hammering heart, how about, and pick, one of the big hospitals, and Dr. Starr said, no, I think you need to get to the place quickest that can do the procedure, and counseled me through that. And like I said, again, Mercy is a facility I've not been to, and I was very impressed, very impressed.
Tom had 2 blockages. One artery was totally blocked. We opened that one up. We found that he had another 80 or 90% blockage in an artery on the other side. Okay, this is Tom's actual coronary angiogram. You can see this. I'll freeze it here in a second. This is the tube we used to go up from the leg. The tube we put in the main coronary artery, called the left main coronary artery. These are the 2 arteries on the left side. As you can see, the artery stops right there. You can see right there, so it's totally blocked off. It's totally eliminating blood flow to this part of the body, this part of the heart. Normally there should be blood flow down here. Here's after we're all done. Look at that, just like new.
If we would have waited or continued to wait, or if I would have ignored it, I probably wouldn't be having this conversation today. They said a couple more hours.
Yeah, Buffalo ED has been fabulous to work with. We're all part of the same team. I look at it, we're one program, same heart program at Buffalo, same at Mercy, same at Unity. We do things the same way. We meet on regular basis to improve quality. We have the same protocol. Buffalo has done a great job. In fact, they're one of the best in the system at identifying the heart attack, getting the correct medications in, and getting the patient transported as quickly as possible. They are extremely efficient, and we're very excited to work as part of their team.
I was very pleased with my care. Very, very pleased. Like I said, you have, again, for you to tell me it was only 11 minutes, a lot happened in 11 minutes. A lot. And again, not only with me.
If you ever have to go to the Buffalo Hospital, don't be afraid. I had such a fantastic experience in care over there that I would recommend it to my best friend, which I did.